Hi, I'm afraid I have some bad news. In my opinion, they are not going to offer pain relief for IUD insertion. Well, let me explain. In June, four eminent female gynecologists had a Zoom meeting paid for by Bayer in response to all the news and stories about bad IUD experiences, and they went over the pain relief options and what they do and basically nothing's going to change. I was really concerned about their understanding or lack of understanding of informed consent, i.e., some clinics offer every woman a local injection to the cervix or cervical block, and it is effective. However, they talk disparagingly of that. Basically, they went, why are you offering every woman, quote their words, not everybody needs it? Well, that's true, but everybody should be offered it, because the conversation goes, would you like an injection into the cervix? Not everybody needs it, but would you like it? It either goes A, yes, B, no, C, I don't know, what do you think? Basically, the way they talked is it's going to be down to the clinician's discretion. That's not offering every woman pain relief. They went over the list. Entonox is quite often effective, not on everybody, but quite often. But they said that was just too impractical, and that is rubbish. The only thing I can think of is that they say it's impractical is because of the storage and the use of the gas bottles, because it's unlikely that it will be in a corner, a gas bottle in a corner on wheels. However, being a welder, I know about the health and safety aspect of gas bottles and the storage and the use of them. It would be a few minutes a year or every 3 years, health and safety form, and it would be a separate company that would deal with the facility, the swapping of the bottles. So that's utter rubbish. In fact, I would even say it is laziness. It's laziness that they don't want to offer women the Entonox, or quite possibly it's down to cost. There is no money in the system anywhere. They would literally have to go to the government cap in hand and say, we need this money, X amount of money for infrastructure for Entonox. And it's actually needed for other procedures. Some women need it for smears or other procedures that can be done in clinic. It can be done in GP surgery. They also mention local injection. Now, they also mention that there's no proper training to do a cervical block. You think it's a common practice, but some gynecologists are taught wrong placement. So they also talk about it shouldn't really be done in GP surgery. Well, it can and it can't. It can be. There's no safety issue with this. However, it does increase fainting attacks. It also takes longer. It takes longer to do it, and it takes, most importantly, it takes time to soak through, to work. That's why they don't want to do local. But the thing is, that is possibly the most effective way of reducing pain insertion. It doesn't reduce the pain after insertion, but it definitely helps that is the biggest weapon in the arsenal of pain, and they simply don't want to do it. And the result would be you would have to go hospital to have it done with a local, because they can't do it. They haven't got the resources, manpower, female power to do it in a GP surgery. Then they also mention sprays. So this is the only good news in this saga, is that they say the gels and all that, 2% lidocaine, they don't work. However, there is a spray what was concerning was that she was mentioned that the spray is used for the back of the throat for gastroscopies, and she said she didn't replace the nozzle every time, she was just careful not to touch anything. Well, that's really concerning. That's really poor hygiene. They are pence, these nozzles. Also, she said she had trouble directing it, so they've been using a straw. And they said they're hygienic. Well, no, they're not. They're not sterile as for surgical use. They may be sterile for you to take a drink of, but they're not medically sterile. So that's a concern. So that could possibly work, but everyone's got to be trained in it. They've got to get the nozzles right, and basically that's not going to filter through anytime soon. They also mentioned that the best one is Vocal Local. Vocal Local is where they mention EastEnders and Chit Chat. As an eminent gynaecologist said, Sahir Sundar, vocal locals don't work, but communication is important, and this is it. This is the thing, communication. Communication is both ways, not verbal diarrhea. It really is concerning that they think this works. Also, then about care, support, and diazepam. Well, they said if it was really that bad, they wouldn't be getting off the bus. Well, you know, and I know, you can work yourself up. You can psych yourself up to doing something you really don't want to do and you find traumatic. So the fact that they think there's no need for this when there possibly is more. Also, they mentioned tramadol. Tramadol is never going to happen, and it is an opioid, so it does have genuine concerns. However, Voltarol, which is the only one that works for procedural pain while it's happening, is an NSAID like ibuprofen. However, one nurse practitioner said they just wouldn't prescribe it, even though they said the suppository is unnecessary, or oral is just as good. They wouldn't. So there's a drug that will take the edge off. It won't take it away completely, but they won't prescribe it. So basically, we're left with nothing's going to happen unless you kick up a fuss again. And I believe the biggest thing is there's got to be money earmarked for this. If there's no money earmarked for this, nothing will happen, because because they mention cost several times for very small things, but they mention cost because local anaesthetic is pence actual. They mention, so unless you earmark money for pain relief, nothing will happen, because there is no spare cash in the system. And I do find it strange that Bayer, one of the manufacturers of Mirena coils, was one of the first to panic. So it might be an idea to go after them as well. Okay, thanks, bye.